All right, Molly, you're all set.
Thank you. Is there anyone in the waiting room we need to let in?
Yep, everyone's in.
Awesome. Thank you so much. Good morning. Welcome, everybody. And I am thrilled to call to order the September meeting of the Outreach and Engagement Committee. Stephanie, could you do the roll call, please?
Of course. Good morning, everyone. Adra Bermuda Zimmerman has not joined us yet. Isha Canada will not be joining us today. Adrienne Cochran,
Present.
Sheila Hummel,
Present. Good morning.
good morning. Molly Weston Williamson,
Present.
and Justin Zartman.
Present.
All right, thank you. We have a quorum.
Thank you, Stephanie. And I should note the time is 9:04. I would take a minute to acknowledge if we have any members of the public joining us. Thank you so much for being here with us today. And with that, I'll move on to our first item of business, which is review of the August 15th meeting minutes. Is there a motion to approve the minutes?
So moved.
Thank you, Justin. Is there a second?
I'll second.
Thank you, Adrienne. Any discussion of the August minutes? Okay. All those in favor of approving the August minutes, please say aye. Aye.
Aye.
Aye.
I believe the ayes have it, but are there any abstentions? Any against? Okay. The minutes are approved, and I'm going to turn it over to Jessica for the annual report update.
Thank you. Let's see, which screen. Somehow I never learn, no matter how many times I do it. All right. So as you know, we released our 2024 annual report in a couple days before the September 1st deadline. And so just wanted to provide a high-level overview of some of the key facts. As you know, this is a requirement in our statute to provide this annual report. And as a result of the legislative changes in Public Act 24-5, this year the report due date was moved from July 1st to September 1st in order to consolidate it with our financial and operations report. So the information in this annual report covers July 1st of 23 to June 30th of 24. This is our map that, as you know, Maddie updates every month. So shows sort of visually cumulative usage per 10,000 residents. So the areas in the red and pink are higher utilization versus the blues and greens are lower utilization rates. Since the beginning of our benefits administration, paid leave has provided over 798 million in benefits to nearly 118,000 workers throughout the state. And as the map illustrates, we have seen claims from every town and city throughout the state. So this year, we really wanted to kind of focus on meet the authority and kind of see the work that goes on behind the scenes to keep this program running smoothly. So we shared, of course, our org chart, and then we sort of broke it down by team to give a little more context as to what each team works on. So, you know, from our humble beginnings in 2020 to where we are now, you can see our team has grown, you know, pretty exponentially, and we're up to 45 staff members now. So for each slide, there's kind of a focus on a different area and what the highlights were from this report. So in terms of claims, we received almost 92,000 claims, applications for benefits throughout the course of the fiscal year. We approved 75% of those applications and denied 24% of them. And in terms of the SLAs with AFLAC, AFLAC has met or exceeded all 24 of the service levels required by our contract. So they make 99% of eligibility decisions are made within 5 days of the application being received and complete with all the documentation. Excuse me, 93% of all decisions made within 5 days of a receipt of a completed claim. 85% of calls answered in 30 seconds or less, and 97% of issues resolved during a single phone call. And let me just clarify, because I did sort of misspeak on the first 2 bullet points. The first is 99% of the eligibility decisions being made, and then the second is the claim decision. In terms of approved claims, we continue to see an employee's own illness or injury being the largest reason for applications at over 53%. followed by pregnancy and childbirth, and then bonding and care of a family member. And then the other reasons, including family violence and military family leave and bone marrow and organ donation, round out to get us to 100%. On average, the leave duration is about 7.78 weeks with a weekly benefit payment of $707. Outreach and engagement, our focus over the past year was really filling gaps in awareness and building partnerships with community organizations. Of course, that's why we brought Nicole on board, and she's been doing a fabulous job of that. Some of the big highlights in terms of projects over the past year, of course, the website redesign and replatform we had been working on for quite a while, but that site did go live. We're just celebrating a year. It was last September. And a big part of sort of filling that gap was the translation abilities now with our new site into 8 different languages. The Paid Leave Spotlight, that's a series that actually Amber has really taken ownership of and picked up and run with. So that's a series of short videos on different aspects of paid leave, really kind of breaking down different areas where we know there is some confusion into 5 to 10 minute, really short, digestible videos, sometimes accompanied by walkthroughs of how to do specific things on the website as well. And then, of course, our 2 newest members of the outreach and engagement team, Nicole is our community partnerships liaison, and Virginia is our grants and contract specialist to oversee our new community education coordinators initiative. In finance, at the end of the reporting period, we had 142,165 employers registered with us, and just about 3,200 sole proprietors or self-employed individuals. The trust fund received $457,185,975 in contributions, and the fund balance at the close of the reporting period was just over $566 million. And of course, as you've seen in the board meetings, we look at, our actuaries look at 3 key metrics to, look at fund solvency, and the fund meets those targets in all 3 of those metrics. And then quickly, I won't go through this in detail, but if you'd like to refer to this, the appendix, we just broke down the claims by gender. High level, we continue to see women accounting for over 60% of the claims. By age, we continue to see the younger demographics, namely 28, 43, and 44, 55, making up the bulk of the claims that we see. And then in terms of denied applications, again, something we continue to work on, education, because not receiving all the documentation is the top reason, for denials. So we continue to look for ways to clarify that for folks and make it easier for them to provide everything that we need up front. And then we have a slide that will talk about reconsiderations and appeals. We do know that the majority of the appeals are actually, decided in favor of what our initial decision was. And as a result, DOL is dismissing the majority of those, or they're being withdrawn by the claimant. In many cases, they are simultaneously having a reconsideration with AFLAC at the same time that they filed the appeal, and the reconsideration decision comes in quicker. And oftentimes, because it was missing documentation, we're able to overturn and give them an approved decision. And that concludes the annual report overview. I'm happy to answer any questions.
Are there any questions for Jessica? I think the annual report is excellent. I think it's worth noting that a benefit of the consolidation with the other report, which moved this report later, is that this year's annual report actually has data that cover the whole fiscal year, whereas in previous years, just because it had to turn around so quickly, lots of stuff had to be truncated at the end of May, because you can't turn around numbers instantaneously. And so I think that's another benefit of this move. I do want to make a mark, and I think you're not the right person to ask the question for, but I think for future board meetings, it'd be really helpful to contextualize that 24% denial number in relation to the reconsideration number. So to help us understand, once you sort of subtract out folks who do end up getting paid through the reconsideration process, like what does that make presumably that takes that 24% down. But I think that would be a really useful thing for future board meetings, but I don't want to pop quiz you on something that you're just
No, good. I agree with, I think that's great. And I will make sure that I share that with John because he's the one that would be able to finagle those numbers and kind of get a ending approval number, if you will. So
Yeah.
thank you.
That would be great. And I do think it was really helpful to have, in addition to in the annual report in this presentation, broken out the reasons for denial, because it does seem like some of those are things that we might think about in outreach strategy, particularly for folks who like aren't a non-covered employer or otherwise, like, because we don't want folks like wasting their time applying for something. We can give them even if it's the correct legal decision to deny the claim. But I know that's something that the authority is always working on.
Yes, and we're really you know, hopeful that our CECs, our community education coordinators, are really going to help us be able to address that number, right? Because they'll be able to talk people through that application process and hopefully explain to them from the get-go what things they need so that we don't have that, you know, sort of gap.
That's super helpful. Anything else for Jessica? Okay, so now that we've gotten the annual report update for Jessica, I believe we have some more general updates on outreach and engagement from Jessica.
Yes, thank you. All right. All right, so I last month gave you an update of what we were doing in August and September, and now I wanted to share October, and October is super busy, so it takes up a whole slide all by itself. So I think what I'm excited about this month is we have a really great mix of business focused and sort of end user consumer focused events, and we have a lot of diversity in terms of not only the types of events, but also where we're going to be around the state. So Erin has been invited back to the Connecticut Bankers Human Resources, that should say association, sorry, not alliance, but their conference. So she'll be presenting to them in Bristol. Nancy always attends Making Strides Against Breast Cancer in Hartford. That's a great event for us, and so she will be representing us there. Something new for us, the Northeastern Connecticut Chamber of Commerce Business Summit, which is in Hampton, will be there. And then we'll also be in Guilford at a business resource fair. The inaugural Maternal Health Conference, which is being held by the Hispanic Health Council, is going to be in Hartford. We will be there. We'll be at Access Health's Community Health Conference in Waterbury. And then Nicole and I will be heading to Bridgeport for the Latino Business Expo in the middle of the month. Another new thing that we're really excited about is a collaboration that we are doing with the Jordan Portco Foundation, which is an organization that focuses on mental health and suicide prevention. Nicole had a relationship with them from her previous work and was able to connect us. And so they do a series of what they call Fresh Check Days at, well, they do it across the nation, but the organization was founded here in Connecticut. And so this is where the organization is on site at colleges at the beginning of the semester, just to provide mental health resources and kind of, you know, check in with students as they're sort of getting back into the swing of things. And so we will be at a series of these different events throughout the state, the first one being at Manchester Community College at the end of the month. So we're excited to partner with them. We'll be at the Connecticut Association for Healthcare at Home Conference and Expo and the annual Disability Resource Fair, both of which we've participated in before, as well as the CBIA Employment Law Conference. We always try to go to the employment law and the HR conferences because we know, especially we're anticipating now with the new paid sick days law, that there will be, you know, questions that we can answer and information we can provide. So busy month. We're out and about all over the place. Excited that you've heard me talking about 5 Minutes of Impact, our new virtual series. This past one was our first bilingual episode. So it was with Civic Health, which is an organization in Danbury, a community organization. They have a healthcare division as well as community services division. And so Nancy conducted the interview in English and Nicole conducted it in Spanish. So we're excited about that. And we're definitely looking forward to doing more bilingual episodes in the future. Also excited to announce that we participated in an employee survey back in the spring. And as a result of that, we were selected as a top workplace by the Hearst Connecticut Media Group. So this is a survey that is based on questions about purpose, leadership, collaboration, motivation, growth, learning opportunities. About 90% of our employees participated in the survey, and 55 businesses were selected throughout the state of Connecticut, and I'm really excited that we were one of them. I think it just, really goes to the culture of our workplace that Erin, starting with Andrea and continuing with Erin, has cultivated. And so, we have some recognition in some of the Hearst papers and Connecticut Magazine, and this it got blurry because I blew it up, but this is one of the ads. So if you're reading any of those publications, you might see that. And this is just a quote from one of our employees. So I just think it's really great to see that our staff, we really do, as you all know, believe and are passionate about our mission. So that was exciting for us. And then you've heard me talk about before that we are doing a series of articles in some different publications throughout the state that are for native speakers of different languages. That includes La Tribuna, La Voz Hispana, La Visión, and the White Eagle newspaper. So I just wanted to kind of give you an overview. We've been doing this since January of the different topics we've covered. Everything from sort of the differences and intersections with FMLA to eligibility, the expansive definition of family, info for sole proprietors, and now getting into more detail about the specific reasons for leave. So the most recent one that I wrote was about family violence and sexual assault, so that we could really focus on that change in the law that includes victims of sexual assault with the ability to receive benefits. And so now I'd like to ask Virginia to come on camera and just give an update of where we are with our CEC program.
Hello. I'm just going to give a quick overview. The purpose of the Community Education Coordinators training is to provide them with an in-depth understanding of the Connecticut Leave benefits so that they can then go out and do direct support with workers and conduct outreach within their communities. So the training series is going to be 7 weeks of online Zoom trainings, culminating in an in-person training wrap-up in December. So the December training is going to be focused on thanking everyone for attending all the meetings, handing out certificates of completion. So it'll be a little bit more of a celebration once we get through the 7 weeks. So each week we'll cover one session topic. And the trainings will be held twice, so on Tuesdays and Thursdays. So this is to provide some flexibility for people's work hours. So if they're unable to attend a Tuesday session, they can attend a Thursday instead, because it will be the same training held twice. And then on each Friday, we'll be having scheduled office hours for any questions that arise. If they have anything that comes up that they want to ask about, they have the opportunity to do that outside of the training sessions. So each contracting organization will also be assigned a person from our benefits team to act as a quote unquote mentor. So they'll be able to help with any technical questions that come up about the benefits process, like applications or remissions or anything like that. So we're hoping to give them as much support as possible. And we'll be continuing to provide trainings or updates on benefit policies or anything like that after these trainings are done throughout the program year. So then they are most up to date on the information and they're able to do the program to their best abilities. So next slide. So just going over each topic of the session. So in week 1, we'll just be doing an introduction of Connecticut paid leave and Connecticut FMLA. So this is more of an introduction meeting, getting them set up for an overview of what we'll be covering for the next few weeks. Session 2 will be covering employers, so employer responsibilities under Connecticut paid leave, such as contributions, what that process looks like. And then we'll also be covering in week 3 employer coverage and employee eligibility. So which employers are covered versus non-covered employers under Connecticut paid leave, and also how to determine if an employee is eligible underneath that. So in the 4th week, we're then going to go over qualifying reasons and the types of leave, including definitions and any relevant legislation that affects this. So next slide, thank you. Oh, I think I
I'm sorry,
forgot.
Virginia. I somehow duplicated a slide instead
Oh,
of putting.
Totally fine. I
I
can pull up
apologize.
my list that I have. So in week 5, we're going to be going over the application process for Connecticut paid leave benefits. So this will get really into the nitty gritty of like what documentation is required, what the AFLAC portal looks like, how to navigate that system. This is especially important because of the, we talked about the missing documents rates and things like that. So we're hoping that with this training and knowledge that our community education coordinators are going to help through direct support to avoid those pitfalls, avoid some of the traps that people fall into where they're getting denied just for like easy, simple reasons. So we can avoid that in the beginning before we get through that denial process. Week 6, we're going to be going through the benefits. So how benefits are calculated, how they're distributed to beneficiaries, including like payment methods, and then any tax considerations through that. Week 7, we're going to go into what to do if your claim is denied, the options that you have, the reconsideration and appeals, including common reasons claims are denied. As you can see, there's going to be a lot of overlapping of topics, but we're hoping with the repetition of some of these more important points that it'll help our coordinators out in the field. And then finally, like I said, we're going to be doing a wrap up in December, going back over key points, going over resources. We're going to be providing them with some outreach materials also to get them started, and then kind of going over next steps for the program year that's going to be starting in January. And like I said, we're going to be distributing a nice, training certificates of completion. So it'd be like a little graduation celebrations because this is a lot of work, and we're very excited that they're taking the time out of their work schedules to come join these meetings. So that's the summary of the trainings we're going to be doing. After the end of December, like I said, we're going to be continuing these office hours throughout the next program year. We're also going to be having the mentors continue their support through the program year as questions come up. And then we're going to be also continuing having meetings with them monthly and quarterly to ensure that they are supported during this whole project. So that's my overview.
Thank you. Thank you so much, Virginia. Yeah, does anyone have any questions for Virginia? Well, I'm excited to see the trainings get started. This is a really exciting and innovative program, and I think it's clear how much work has already been put into setting folks up for success, and I love the idea of the graduation. I think this is going to be really, really impactful. Okay. I believe next on our agenda is Nancy with the podcast updates.
Good morning, everyone. Just let me see if I can share my screen. Can you all see that? Can you see my screen? Okay, great. This is really just a snapshot of how the podcast has grown from its inception in February of 2022 through September of 2024. It's really a nice steady increase and growth of downloads, which we love to see. And I can't wait to hit 6,000. That's the next goal for me. So in September, September 23rd through the 27th is Fall Prevention Week. And my guest was Angela Vasquez. She's the Healthy Aging Program Coordinator for the Bureau of Aging in Connecticut. And she talked about Fall Prevention Week and how they can help 60-plus-year-olds with tools they need for fall prevention and how to stay healthy. And she had so much great information. And I think I told you last time that she actually used the program because she had 2 miscarriages. So she talked about the importance of Connecticut paid leave in a personal way, and it was really, really impactful. The other podcast that is coming out on Monday, and this is Marisa Giornella. She's the co-founder of the Jordan Porco Foundation, and the podcast with Marisa will discuss the origins of the Jordan Porco Foundation, which is that her son committed suicide in 2011 as a freshman in college. And we talk about the intersection of mental health and Connecticut paid leave. And Jess touched on this, but we're doing appearances at the Fresh Check Days in Danbury, where they have a lot of groups, social groups, and it's a fun event talking about serious issues that affect freshmen and other people in college. So we're doing Fresh Check Days. The first one is coming up Tuesday at Naugatuck Community College, then Goodwin College on 10/15, Manchester Community College on 10/23. And there's one in Waterbury in November that has yet to be announced for that one. But it's great with this continuing outreach and engagement that we're really hitting a lot of people. And for October, it is Hispanic Heritage Month from 9:15 through 10:15. And my guest is Gladys Ramos. She is the Stratford Hispanic Heritage Committee co-chair. And we're trying to get on a Zoom today to try to solidify a time to do this podcast and get it up in early October. So she's going to talk about what the Stratford Hispanic Heritage Committee is all about and what Hispanic Heritage Month means to her and how Connecticut Paid Leave can help with benefits in that arena. And the other one that we are going to do, I'm actually recording this podcast tomorrow with Allison Jacobson. She is the CEO of First Candle, and we're going to be talking about Safe Sleep and SIDS Awareness Month. She was just out at a maternal healthcare conference. I believe it was in Seattle or somewhere out west. But we're going to be talking about maternal health care, the disparities that exist, safe sleeping tips for parents, and to know a little bit more about SIDS and how Connecticut Paid Leave can help. And I'm very quick with mine. If anybody has any questions, I'd be happy to answer.
Thanks so much, Nancy. Any questions for Nancy? I'm excited to see us hit 6,000, and I'm sure we will get there very soon. And with that, I believe next on our agenda is the legislative update from Maddie.
Great. Good morning, everyone. I just have two quick slides. You can see my screen, right?
Yes, we can.
Okay, thanks, Steph. Okay, so I just have another brief update on the implementation of Public Act 2405 before the law takes effect in just a few weeks on October 1st, came up pretty quickly. So as I've mentioned, earlier this summer, kind of repeatedly, our priority is really outreach to entities that will no longer be considered a municipality as of October 1st. So thanks to our IT team, there are updated instructions on how to register as a newly covered employer due to the legislative change on our website. We also hosted one final information session earlier this week. The recording is available on our YouTube channel. I'll also send the link with my slides. The webinar included information on all of the changes under the new law, but it really had an emphasis on the new definition of municipality and what it means to be a covered employer under Connecticut Paid Leave and Connecticut FMLA. We also continue to do a lot of, one-on-one outreach to different entities and really kind of provide one-on-one assistance to when people are contacting us if they're having trouble registering as an employer or just have questions about whether or not they're going to be covered as of October 1st. So as you also know, effective October 1st, healthcare providers are required to display Connecticut Paid Leave information in a manner that is accessible to their patients and caregivers. Healthcare provider under the law has the same definition as Connecticut FMLA, so it is pretty broad. This is an important piece of the new law because we know that healthcare providers and their offices, often interact with people who may need our program and could be unaware of it. Over the past few weeks, we've developed an informational poster or flyer in English and Spanish. To distribute this information, we collaborated with the Department of Public Health in their licensing system, database, whatever you want to call it. So we were really grateful for Department of Public Health and their partnership. Last week, they sent our flyer and information about the new requirement to their list of over 74,000 licensed healthcare providers. And this is just the flyer that we created. It's in English and Spanish. This is also available on our website. We're working on a tab with more specific resources for healthcare providers that should be available soon. But yeah, really our goal with this was to make it really simple and easy to understand and a clear place to go for more information. And yep, that is my update.
Thank you so much, Maddie. Any questions for Maddie? I love the healthcare provider flyer, and also I'm really impressed that you got the Spanish flyer to fit in the same space, which I feel like is always the challenge in outreach material since the Spanish stuff tends to be longer.
Yeah, no, agreed. Shout out to Jess for that. So thank you. Yeah.
Anyone have any questions for Maddie? Okay. With that, is there any old business anyone would like to raise? Any new business anyone would like to raise? Hearing none, is there a motion to adjourn?
So moved.
Thank you, Justin. Is there a second?
Second it.
Thank you. I think that was Sheila. Any discussion of the motion to adjourn? Hearing none, all in favor of adjourning, please say aye. Aye.
Aye.
Aye.
Aye.
Aye.
Believe the ayes have it. Thank you so much, everyone. The time is 9:34 a.m. and this meeting is adjourned. We'll see everybody next month.
Thank you.
I think
And congratulations again, Justin.
Thanks.